purpose. Firstly, they have high intensity and low frequency to release endometrium during menstrual phase. Contraction play the role during the implantation of the embryo. Both have shown their opposite effect on the results of the treatments. Peristalsis. Results of the treatments. Functionality of progesterone. It was in the 90s when studies of uterine contractility began. It was then when video recording accelerating method was established to assess endometrial cavity. This 4D image is the first dynamic ultrasound scan that was performed on a patient. From this first 4D scan, view using HD Live. 4D ultrasound caption should be performed with the same settings that 3D ultrasound. It is important to enlarge the window or the region of interest as much as possible, as well as sound is to control patient's movements without losing the uterine coronal view. Uterine peristalsis is like waves that go from the cervix through the endometrial cavity to the fundus, moving and modifying it. They are easily visible. The importance of showing the potential role on reproductive outcomes and providing credibility to this new tool. Following our protocols, uterine peristalsis has been used interchangeably vaginally and subcutaneously, which was in patients with more than 1.5 ultrasounds to a senior doctor, to a junior doctor, and to a nurse. An intraclass correlation coefficient of 0. 4D ultrasound machine, experience of the sonographer, patient reliability, to observe the dynamic behavior of the uterus. Asynchronous patterns and arbitrary directions deserve further studies to know their implications. Limitations include access to 4D is limited to the measurements of uterine peristalsis. It is impressive to observe the dynamic behavior of the uterus. Asynchronous patterns and arbitrary directions deserve further studies to know their implications. Limitations include access.
我在动的这个是胚胎的外管。好，2.6，我们要进去1.3，你人行走开。外面是2.6，所以我们进去1.2，剩下1.4。好，可以。慢慢推。好。开始。 白色的是胚胎的外管，内管进去1.2、1.1，所以胚胎会距离子宫顶1.3到1.5左右。左右要换一下占卜。
Expertly performed embryo transfer using ultrasound guidance is a critical part of the IVF process. Here we see the catheter tip coming up into the uterine cavity from the cervix. We advance the catheter tip just past the middle of the cavity, then pull back slightly and press the plunger. We see a flash of media containing the embryos coming from the tip. Then we slowly withdraw the catheter and it's done. That should do the trick.